My name is Abby, and today I am going to be talking about my experience in the process of potentially getting diagnosed with endometriosis. So, I am getting my laparoscopy done at the end of this week, which will determine if I have endometriosis or if I don't. But I wanted to I'm gonna make two parts of this video, one before my surgery, one after my surgery, just talking about my process of the journey of potentially getting diagnosed, what I've dealt with so far, explaining a bit about the symptoms of endometriosis and what the surgery was like for me and what the recovery is like. My goal of doing this is I hope that somebody else watches this. If you're dealing with any issues related to intense period pain, pain during sex, any other adjacent issues, that this might help you in understanding a bit more of what the process would be like if you decided to pursue surgery to find out if you have endometriosis. So that's what we're going to be talking about today. I have had painful periods since I got my period back when I was 12 years old. I have gone to the doctor multiple times for it over the course of my teenage years into adulthood. I'm now 24, so I started the process of going to my gynecologist, asking about the intense pain I was having when I was a teenager, and it stayed pretty consistent, or actually I think it's only gotten worse as I've aged. So when I was younger, I had gone to the gynecologist. I explained that I was having really intense cramping and I was prescribed naproxen, which personally didn't do anything for me. I also, went to a different doctor to find out if I was having heavy bleeding, because I guess as women, we're not taught very much about our own anatomy or about the process that goes on when you're menstruating and what's normal and what isn't. So I didn't know if the amount of pain that I was in, if the amount of bleeding that I was having was considered normal. And I don't really think I understood that until recently, which is wild because I'm in my mid-20s and I've been menstruating for over a decade now. So I know I'm not alone. I know that there's so many other women out there who have had the exact same experience or a similar experience where they're just not being told this information. So went to the doctor when I was younger. They kind of just gave me naproxen and that was that. And then I kind of continued that conversation with, I ended up switching gynecologists, I guess. I don't know what the plural is of that. But I switched doctors, not because of that. I think maybe she wasn't available or something. So I went to a different doctor and I've been with her for the past, 7 years. So I, once again, have brought up the issue of the pain that I was having. I've gotten ultrasounds done. Nothing came back. And the ultrasounds, they rule out typically cysts, fibroids. Sometimes endometriosis will show up on there, but it's not particularly common from what I've learned that it'll show up on there. So I knew that there was, to what they could see, nothing wrong with my anatomy, nothing wrong with the way that my uterus was shaped, because sometimes there's issues with the actual how our uterus is shaped. There can be problems there if it's tilted in a specific way. There's a bunch of other issues that can occur in that area. But I also knew that I didn't have any fibroids that they could see, or cysts, or anything that was down there that could be causing pain that was visible to them through the ultrasound. So after getting those done, I have had them done a couple times now because this pain has been persistent. That kind of leads us to where we are now. So I want to talk a little bit more about the specifics of the type of pain that I was having, and the other kind of adjacent symptoms to that intense cramping pain. So when I've heard people talk about cramps, as I said before, it's very vague as to what is normal and what isn't. I never really understood why they were called cramps, because for me, I've always gotten a very intense, like, stabbing sensation was typically what cramping pain I would experience. It wasn't until recently that I learned that most people, when they're talking about cramping, they're just talking about, like, literally a cramping feeling, some discomfort, mild, but not extreme. The last time that I had my really, really extreme cramping episodes, which now are more infrequent because I'm on the pill, which I will get into that side of things. I literally was in so much pain that I was like, the person that I was with, literally, I ended up like, they offered me their hand to hold and squeeze because I was squeezing I was in a car, I was squeezing the seat that I was sitting on, clenching so hard because of how much pain that I was in with these cramps, because it literally just feels like I'm getting stabbed repeatedly in my entire pelvic region, and even into where like my groin vagina area would be, my labia. Like it will feel like it's kind of wrapping around. So it's really, really intense pain. So that's just the period symptoms. And I personally will get those cramps, even I'll get them before my period too. I'll get them like right before my period comes into the beginning of my period, and the amount of days I have of them and the frequency has changed based on the birth control that I was on, because I have an IUD and I also have the pill, which again, I'm going to kind of get into that a little bit later when I talk more about treatments and the rest of the process of me kind of coming to this place of considering endo as a potential option for me. I'm just gonna get some water quickly. So the intense cramping pain, really, really bad. And also another kind of thing for me was that it wouldn't always respond to any pain meds. So I would just be basically suffering through it until it stopped. And if you know anything about endometriosis, that is the number one kind of hallmark symptom, is really intense pain. So on top of those really intense period cramps that I was having, I was also having pain with sex. So sex has never been comfortable for me. I've always had a lot of pelvic pain. That was another thing where I didn't really understand when people say that it would feel good, because penetrative sex for me has always been painful to varying degrees, but always painful. It didn't just stop at my first time, it was every time. I've also had a lot of GI issues, bladder issues, just sort of that entire like area, stomach down, has had a lot of problems for me. So that moves us into talking about endometriosis specifically, and how I've gotten here in my journey. So as I had mentioned before, I had gotten ultrasounds done. I'd been talking with my doctor about these things. I got hormone testing to see, what my hormone levels were like. Those came back okay. Additionally, a couple years ago, I got diagnosed with PMDD, which was something that I had also been suffering with kind of at the same time. And once I got that diagnosis, I was like, okay, maybe the other stuff is related to that. Like, even though I had heard of endometriosis, nobody had talked to me about it. Nobody had, brought up that was a possibility for me, or that was something that I should be looking into. which is a very common experience I've had with doctors, where the thing that ended up being the issue, I ended up sort of having to bring to them instead of them offering it up as an option to me, which is frustrating, and I'm sure that so many other patients have experienced this. It's very kind of irritating to deal with. So I went through that whole thing, got that diagnosis. I've had an IUD in for probably like 7 years now. And within the past year, I got on hormonal birth control. I meant to say progesterone only birth control, but it's still correct. So I've got that done because that is a treatment for PMDD, and that's thankfully helped manage my symptoms, so that's been great. That leads us into the past couple months. So I've had multiple episodes of that really, really intense cramping, and that led me to discussing it with my gynecologist at my yearly appointment, where she suggested that endometriosis was something that we should consider as a potential option as to what is causing my pain. Reason being is the symptoms I've already listed. Very common symptoms with endometriosis are the intense cramping, pain with sex, bowel issues, constipation, diarrhea, especially around your period, other sort of like bowel and GI issues associated with that as well. Pelvic floor issues, bladder issues. There's so many things that kind of tie into it, and there's more symptoms than I'm not even covering, because there's quite a lot that can be related to this. Because of, it's also such a misunderstood condition still. Why this endometrial tissue that lines your uterus is growing in other places in your body. I've even heard of, it's so common to be growing in other places in your pelvis. I've heard of people having it grow in like their diaphragm area and causing issues with their breathing. Like, there are so many different things that endometriosis can do, and like other systems in your body that it can mess with, which is obviously kind of scary and painful if that is what you're dealing with. It also can be asymptomatic. So while I went over all the potential symptoms, at least some of the main ones, some of the ones that I've had, it can be asymptomatic as well. And the severity of your symptoms doesn't necessarily equate to the severity of the endometriosis, because it does affect everyone differently, like everything. So that is also something to consider. It's always a little freaky when things can have no symptoms, but you can be suffering with them. So for me, obviously I've had quite a few symptoms that have led my doctor to think that this is potentially what's going on for me. So now that we've kind of gone over that, gets to what are your options as far as diagnosis and then treatment. I obviously had already gotten ultrasounds done, nothing came back from them. There is the option to get MRI done. You can get MRIs done to check for endometrial tissue growing outside of the uterus, so check for endometriosis. However, from what I've learned about it, it tends to really be good at picking up on deep tissue endometriosis. So not stuff that's more, not surface level, because it's obviously not on the surface of your skin, but not as deep. So that's an option. And I did discuss that with my doctor, and there are kind of multiple reasons why I did not choose to go with that route. Primarily, it is because the benefit of getting the surgery is that if they find endometriosis, they can remove some of the tissue potentially. So, the surgery. It is laparoscopic surgery, which means that they will make a couple incisions, small incisions, into your abdomen so they can stick the camera in there and have a look around your insides to see if they can find any endometrial tissue or scar tissue that is evidence of endometriosis. So it is an exploratory surgery, it's diagnostic. So the main goal is to see if there's anything going on in there that can tie to endometriosis, or if they find anything else that could explain the symptoms that you're having. My doctor, you can go to people that specialize in endometriosis, and there's kind of a bunch of, I think, debate, I guess, on whether it's okay to get surgery done by your gynecologist, your primary gynecologist, or if you should go to a specialist. I personally am having my gynecologist do it because she's done the surgery before, and I've just worked with her for a long time, and I didn't want to have to go through the process of finding a new doctor, waiting to get seen, having to build a rapport with them and explain to them all the years of symptoms that I've been having, and then trust them enough to have them operate on me. Personally, that just wasn't what I wanted. If that's what you want, that's totally fine. It's a great option. And plenty of people would recommend doing that over what I'm doing, which is just seeing my normal gynecologist. So, I definitely would recommend making sure whoever you see, whoever you talk to about endometriosis, if you decide to get surgery, that they have experience in treating it and they have experience doing the surgery. Now, specifically with the surgery, there are two types of surgery for endometriosis. There's excision and there's ablation. Excision will be them kind of pulling out the endometrial tissue to try and get it at the root. So if they find some of it, they're going to be taking it out of you. Ablation is much more of kind of it's the chemical removal of the surface area of it. So it's not getting deep in there, it's not really pulling it out. And both of those types can be used, but excision is what is preferred and is what you should be looking for, and you can do your own research on that. And I highly recommend that you do to understand it better, because I don't understand ablation particularly well because I'm not having that done. I'm having excision done because that is typically looked at as better to try and get that tissue out more if they find endometriosis there. So those are the two types of kinds of removal that they can do if they find tissue during the surgery. Now that we've talked about the surgery and what that's like as far as what they're actually doing to you, I want to talk a little bit more about sort of the other additional aspects of the surgery besides the very technical aspects. I do want to mention that during the surgery they will be pumping your stomach up with gas so they can move more easily around your organs. So after the surgery, a lot of people, you come out bloated. I've heard that you can have kind of pain up into your shoulders from the gas that they put inside of you, and then that kind of dissipates over the next days or week or two as you're recovering. So that is also some important information if you're wondering about how they do the surgery and how they're getting up in there. Before my surgery, I'm choosing to do a bowel cleanse, a colonoscopy prep basically. It's not something that all surgeons require. Mine doesn't, but I'm choosing to because I have other GI issues, and I tend to deal with a lot of bloating, a lot of constipation already, so I want to try and have things a little cleared out so it's easier for them to kind of maneuver around there, and also so afterwards I don't have my normal level of bloating compacted on top of the extra bloating from the gas being pumped in my stomach. Sorry, my nose is just running. So that is kind of that end of things, the pre-surgery information. As far as post-op goes, I've been told from my doctor that 2 weeks is usually how long the recovery process lasts, and it's mostly because you have incisions, so they want you not to be like lifting anything really heavy for the next 2 weeks, or bending down or twisting or stretching too much, because they don't want you to tear anything that you might have gotten done, and also just the surface stitches, because they're gonna have to make incisions. So that's what the like kind of overview of the potential recovery is like. And then for post-op, a lot of people recommend wearing baggy clothes, baggy pants, comfortable underwear, having pads with you in case you have any bleeding. I've heard that some people like have some light bleeding. So for my surgery, I'm gonna make sure that I have like probably a nice pair of like comfy pajama pants that I'm comfortable in, some like a big t-shirt or sweatshirt, or just something that I feel pretty comfortable putting on, and something that I'll be okay with wearing for a day or two, because you're not going to be showering for, I believe, the like 2 days after surgery. So, and you're going to probably be sore, tired, in pain. Like, you're going to want comfortable clothes. So just make sure that you have that. I've also heard people recommend to bring a pillow with you to put when you're coming home from the surgery, if you're very bloated and you have pain where the incision sites are, to put it where the seatbelt would be hitting you, so you've got something kind of in between you and that, in case that would like press in on you and cause you pain. So I'm going to be bringing a like soft pillow with me just to put there if I need it. And then you can't drink or eat for past midnight before the night of your surgery. So I'm going to make sure that I bring water and probably like a light snack with me to have after my surgery if I'm hungry, like crackers or something like that. And also make sure that I have some like blandish foods to eat afterwards, because I know I get nauseous with anesthesia. So I'm going to make sure that I have like chicken soup, toast, like light stuff to eat post-op. Okay, so now we've gone over all the like that stuff. So obviously I said like I don't know if I have endometriosis. The surgery is to diagnose it. I have no clue. As far as treatments go, I am already on the pill, which is one of the treatments for endometriosis. I'm on a progesterone only pill because I can't take estrogen. So that is sort of one of the treatment methods. For me, it's been kind of hit or miss. I'm still having some cramping. I've had cramping. Like I had like a period of time like in the past month where I had like cramping almost every day for like 2.5 weeks. It was mild, but it was just sort of bizarre. I haven't had a really intense episode of cramping since I want to say July or August, which is good, but I don't know if it's going to be happening again. Besides that, there are medications. I believe my doctor mentioned 2 that you can take that put you into a chemical menopause, so you will not be, I think it just like lowers your production of estrogen, because it's thought that the endometrial tissue, like estrogen, is what helps it grow. So if you suppress that, then you will not have any more endometriosis tissue grow. My doctor offered that to me as a treatment option, even without getting the surgery done. I decided I did not want to do that without knowing for certain if I had endometriosis, because that can cause you to have menopause symptoms. which I did not want to deal with if I wasn't certain that that was what was going on. So that's the other treatment method. Sometimes people also get a IUD that has more progesterone in it. I have the lowest. I believe it's still the lowest. There might be one below it now, but I have the Kyleena, so I have a pretty low progesterone IUD. I could have bumped it up to the Mirena, which has a higher level and is more shown to help with cramping, but I chose not to do that. You can also have that done during your surgery. My doctor offered to do that for me, but I decided against doing it because I kind of only wanted to deal with one thing at once. I didn't want to have to change that as well. So that's what I chose, but you can obviously, look into that and choose differently if you want to. It's definitely easier to get it done while you're under as opposed to having to go through the pain of getting an IUD put in when you're awake. So those are kind of the medical options that I've learned about. There's probably other ones that are maybe used off-label or less frequently, but these are what I know about in the US. I believe there's another medication that's not available in the US that's specific to treat endometriosis. I don't know much about it because I don't have access to it, sadly. So outside of the realm of medication, there's also like some lifestyle things that you can look into. I've heard a bit about eating low inflammatory foods, so eating an anti-inflammatory diet. There are other people online who talk about that in relation to endometriosis, which is awesome, and it has helped them with their symptoms, so that's an option that you can look into. Obviously, some people will be like, exercise, stress reduction. I mean, those are all very general things that can help. And I think as far as that goes, it's really just seeing if it helps you. It's not a guarantee. None of the treatment methods are guaranteed to work for every person. It's just a shot in the dark to see what does. So that's where I'm at. As far as how I'm feeling pre-surgery, I am definitely nervous. I wasn't certain about getting the surgery for a while. It wasn't until I had my pre-op appointment with my doctor that I really felt more confident in my choice to get it done. I think I've had fear on, it's not that I want to have endometriosis, but it's that I want answers. I want to know what's been causing me to have this much pain. I want to know, if there's something I can do about it. I want answers. And I do have the fear of, what if I put myself through this surgery and I don't have endometriosis, and then I'm back at square one and I don't know what's going on still. And that is scary. I have a lot of complex feelings on it, and I think that that's totally normal. I've been trying to remind myself that even if I find out that I don't have endometriosis, at least they can't see it in this surgery. I know people have said that sometimes the first time they get surgery, they can't find it. Maybe it takes a second surgery or something, or MRI or whatever. There's definitely been cases where that's happened and it hasn't been caught, but let's just say in this case, I don't have it. I have been trying to remind myself that that is still information that I didn't have and I wouldn't have without getting the surgery done. Because even if I chose to get the MRI, it wouldn't have been certain that there was no endometriosis there that they couldn't see. And hopefully this option will give me more of a certainty that it's there or it's not. And I've been trying to remind myself that any information is better than no information, and I will be better off by knowing I don't have it than by having it remain a question in my mind of if it's going on. Because if it's not going on, then that means that I have to kind of go back to the drawing board and explore other potential options, which for me, there's quite a few. One is definitely like pelvic floor issues, weakness, tightness, those being things that I know that I deal with. If the persistent GI issues I've had are impacting the cramping pain, if it's just the way that my body is, if I just have bad pain with my periods and there's not a specific reason that they can find. It's a lot, and my heart goes out to any other people watching this who are dealing with this, because it's hard. It's hard dealing with issues related to the menstrual cycle. It's hard dealing with being a woman and having to try and figure all this out, and how much we don't understand about the female body, about the reproductive system. It's really frustrating. So I am hoping that if somebody sees this, that it maybe gives them a little more information about what this is like, about what to look out for, and that they can hopefully get some answers. So I'm going to come back and finish this video after my surgery and let you know what the results were for me and how I'm healing from it and what the overall experience was like. I don't know if I'll end up filming anything while I'm at the hospital, just because I don't know if it's going to be super feasible, but we'll see. Yeah, so until next time.